and thank you for taking your time to be with us here today. My name is Ben Rogers. I am the CEO of COTA Victoria and Seniors Rights Victoria. Before we continue, we'd like to acknowledge the traditional owners and custodians on the lands on which we work and pay our respects to Indigenous elders past and present and emerging. In my case, I'm the land of the Djab people, but I'd like to acknowledge that COTA Victoria operates on the lands of the Bunurong people of the Kulin Nation. Sovereignty has never been ceded. It always was and always will be Aboriginal land. Our purpose today is to officially release COTA Victoria and Seniors Rights Victoria's submission to the Victorian State Budget for 2025-26, which itself is titled Creating a New Benchmark for Ageing. Today is the culmination of a huge month of activities for us as part of the Victorian Seniors Festival 2024, which included attending the Celebration Day, the launch of our recent report with AusNet called Our Energy Futures, and a whole range of other activities. Today, we'll outline what contributed to our thinking on this submission, the issues we believe need to be prioritised to best support older Victorians in need, and a very select portfolio of recommended investments to address these. At the end of the session, we'll have some time for Q&A, and we'll let you know how you can follow up with us on any of the issues we've raised today. Now, I'd like to hand over to the Policy and Advocacy team at COTA Victoria and Seniors Rights Victoria, and in particular, I'd like to hand over to our new Policy and Advocacy Manager, Marshida Koltov. Marshida.
Thank you, Ben. So, for context, the Victorian State Budget outlines how it plans to collect and how it will spend money to provide public services, infrastructure, and support economic growth. So, each year, NGOs have the opportunity to propose funding initiatives for consideration by Victorian State Government and opportunities to support programs that align with government policies and priorities. So COTA Victoria's role in all of this is to ensure that government policies and associated funding reflects the needs of an ageing population and older Victorians. So our priority, we listen to and we advocate for needs that our members and that our research convey to us. We also canvass the views of a range of partner NGOs and peak bodies to make sure that we're in reasonable alignment. So in light of sector engagement and research, COTA Victoria and Senior Rights Victoria are recommending 5 priority areas for funding, and these are underpinned by 12 key actions. If we could just jump to the next slide, please, Steve, that would be great. So if funded, these actions would enable the following bullet points. Firstly, would see the establishment of a clearer vision and action plan to support Victorians to age well, would see an improvement in support for those experiencing elder abuse and improve effectiveness for prevention initiatives, would see a reduction in energy cost pressures and would help older people participate more fully in the energy transition movement, would create more equitable, accessible and responsive health, disability and community support systems, and will help more older Victorians maintain secure and appropriate housing. So with that, I'll hand over to Martin, one of our senior policy advisors, who'll speak to the survey that helped to inform these recommendations.
Thanks, Marshida, and good morning, everyone. So at COTA Victoria, we use a range of different methods for tapping into the views of older Victorians on a whole range of key issues. And to help us with this particular task and really gauge what older Victorians are thinking about state government priorities for expenditure right now, we did undertake a targeted online survey of our members. So that's older Victorians in the community. We did that just quite recently in September, so we're pretty confident it's a pretty up-to-date gauging of people's opinions on this important topic. We certainly don't want to claim that this is a fully representative sample of older Victorians, but we're quite confident that it does represent the views of a fair range of older people across our state. So in this year's survey, the first thing that we asked people to do was to give us a sense of how they rate some of the key areas of Victorian government expenditure in particular, and have a think about which areas they think most benefit older people, including themselves, of course. And those areas that came out most often ranked as having very significant benefit were the four I've noted on this slide. So hospitals and health services generally way out in front at 74% of mentions. Public transport, very strong. Concessions, very strong. And policing and community safety. If we have a look at the chart on the next slide, for those of you who are interested, we've written up a separate little report on this survey, and you can have a look at this in more detail, but you can just get a general sense of 12 main areas of government expenditure, how people's ratings panned out. And you can see people are generally fairly appreciative of most areas of state government expenditure, but there's quite a division of views on some of them, and a lot more people seeing value for older people in some than others. So we then went on, more importantly, for this particular task, to ask people which areas they believe most warrant increased government expenditure right now in this current budget. And those areas that were most commonly nominated were, first of all, health services, pretty much across the board, but particularly community-based services were mentioned. Family violence came out very strongly, and unsurprisingly, but it's good to see that people were explicitly talking about elder abuse in that context. The third area people mentioned was disability support, and again, particularly understanding, I think, state government's role in supporting some of those supports outside of the NDIS. And finally, social housing, which is perhaps not too surprising given the prominence of the housing crisis at the moment. We then dug down a little bit deeper to elicit some views from people on their proposed priorities for investment in programs that more specifically target older people. And the things that came out most strongly were, first of all, community transport, and that was particularly in the outer suburbs. Energy cost relief, and we'll talk a bit more about this later, but still coming up very strongly for older people. Local activities to address social isolation and loneliness. Been an important theme for older people for quite some time, but interesting and important, I think, to note that that's still very much in people's sights. And finally, better support to help older people access government services. So look, that's a very quick rundown on some of the important input we got. And that was certainly terrific to see and to influence the decisions on those priorities that we formed up.
Thank you, Martin. So out of this work that Martin's just spoken to, in addition to prior conversations and engagement, COTA Victoria has developed 5 key priority areas. So we'll talk through these now, but put simply, our first priority area is to ensure that the voices and the needs of older Victorians are reflected in conversations, in policies, and in funding decisions. So to achieve this, we're proposing 2 key actions, which are up on the screen in front of you. First is a recommendation to renew and expand the whole of Victorian Government Ageing Well in Victoria plan for 2026 to 2030. This provides a strategic vision with clear initiatives to support positive ageing. Our second recommendation is to call for sustained resources to support regular community engagement, guiding the plan's implementation. So this should include large-scale surveys and in-person events that are led by older people and that draw on their experience and the insights of the Senior Victorians Advisory Committee. This kind of engagement, which is already proven effective in other social policy areas, is critical for accountability, for transparency and also for tracking meaningful progress towards better outcomes for older Victorians. Jean-Marc, would you like to speak now to elder harm?
Victoria, as the only statewide community legal centre focused on elder abuse, these recommendations are informed not only by the lived experiences of older people, but also by the input of advocates, social workers, and lawyers. Additionally, we work in collaboration with both the elder abuse and the family violence sectors and chair the Victorian Elder Abuse Strategic Alliance. The context behind our recommendations not only includes the high prevalence of elder abuse in Victoria, with 1 in 6 older people affected annually, but also a continuing trend where prevalence is on the rise. Across the sector, demand for elder abuse services is surging. This includes within the justice system, as well as within elder abuse specialist organisations and community legal centres. At Senior Rights Victoria alone, we saw demand increase by 50% from the years 2022 to 23 and more than double from 23 to 24. Despite our best efforts, we are only able to meet just over a quarter of this demand, with our outbound contacts dropping by 30%. This limited capacity, which is seen across the sector, is not only due to the growing complexity of cases we see, requiring more hours from our lawyers and advocates, but also due to the funding cuts, creating a situation where rising demand is met with reduced resources. So in this context, we are making 3 budget recommendations regarding elder abuse. The first one is to increase recurring funding to elder abuse services so that they may better meet the current demand. The second is to allocate new funding specifically for elder abuse prevention, which, unlike other forms of family violence, currently has little focus from government. This would address both the drivers and root causes of elder abuse and help reduce its prevalence. And the third is to invest in improved data capture and information sharing to create a clearer, more holistic understanding of elder abuse in Victoria, which will enhance policy and program design, improve collaborative practices across organisations and governments, and support much needed research on elder abuse. Thank you, Mashida.
So at COTA Victoria, over the last year or so, we've become increasingly concerned about energy and utilities issues and their impacts on older people, along, of course, with many of our community sector partners working in this area. So we wanted, in our submission this year, to really highlight that and draw it out as a separate key theme rather than just subsume it generally under cost of living issues. Utilities are the single largest category of household bills that older Victorians tell us they have difficulty paying. And they also, quite concerningly, tell us that they are often unable to use the energy they need to live comfortably. So the cost and fairness dimensions of this remain very pressing. There's no doubt about that. But at the same time, we were very keen this year to tie this more specifically to the energy transition towards cleaner, greener, more sustainable energy sources, and highlight the issues that older people face in engaging in that transition. There is already quite a range of new inequities threatening to leave many older people behind in that transition and further marginalising them in the energy marketplace. As some of you may know, COTA Victoria recently undertook a piece of research in this area under the steam of AusNet's Vulnerability Research Grant, for which we were very grateful. And I do encourage anyone interested in that to have a look at our report, which is now released on our website. What we found in that report, in a nutshell, was that there was a pretty positive view amongst older people about the energy transition and some of the needs flowing from that. But at the same time, many older Victorians are facing really substantial barriers in getting engaged and taking action in that transition. Some of those barriers are financial and economic. Some of them are attitudinal, and many of them are just simply practical. So flowing from that work very directly, we've got two recommendations for the state budget along these lines. The first really is for a coordinated program of community education and more personalised advice activities to support older people, both to understand and then to plan the changes that they may wish and need to make to their household energy sources. So we think that should take the form of an annual local community grants program, making sure that we really engage people through local grassroots activities, but make sure that's also very well supported and informed by statewide industry, government and community sector peak bodies. The second part of our submission in this area is to undertake a review and consequent enhancement of the household concessions program together with relevant energy change incentives. So this should really ensure that supports are more readily accessible and available, because we know they're not being taken up by too many older Victorians, and to make sure that those more crisis-oriented, perhaps concession programs around people's household capacity are more linked up with what they need and want to do in terms of participating in the transition. We're very heartened to see a number of key bodies, the Essential Services Commission, VCOS and others, really starting to raise these issues around concessions and some of the rebate and incentive schemes themselves. So we're very keen to see a very specific focus on vulnerable older Victorians in all of that work. Thanks.
Thank you, Martin. All right, so priority area number 4 is around the health, disability and community support space. So older Victorians rely heavily on publicly funded health, mental health and disability services. But what we see is that many of these services often fall short in meeting the specific needs of this population, which leaves some older Victorians without adequate care and support. So to address these gaps, we continue to advocate for the development of an older Victorian health and wellbeing action plan. And this plan will foster age-friendly healthcare by focusing on 3 key areas. So the first is around promoting person-centred care that reflects older people's needs and preferences. It also looked to provide alternative service models that enhance care models and ensuring meaningful involvement of older people in decisions about their care. So drawing on the lived experience of older Victorians, the proposed action plan would focus on improved access to health and mental health services, which would enhance the user's experience. We'd look to involve older people in co-design and decision-making to ensure that service delivery reflects their priorities. And thirdly, it's around expanding healthcare and self-care options that promote independence, mental well-being and physical health. We're also recommending launching a pilot navigation support service for older people and their carers. So this service would offer more personalised guidance to help them access health, disability and community services, particularly those falling outside the scope of NDIS and Commonwealth aged care systems. Lastly, more than 500,000 older Victorians currently live with an enduring disability, but many face significant barriers in accessing support comparable to younger people on the NDIS. So to address these inequities, we're proposing targeted grant funding through the Victorian Disability Advocacy Program to support unmet disability needs that aren't covered by aged care or the non-NDIS disability sector, and to strengthen the advocacy voice of older people with disabilities, empowering them to influence policy and service improvements. So our final priority area number 5, is around the housing crisis. If we could just jump to that slide. Thank you. So what we see is that older Victorians are increasingly affected by the housing crisis, which is driving higher demand and also deepening concerns about housing security. So the COTA surveys have shown that 5% of older Australians are currently significantly concerned about becoming homeless within the next year. Older Victorians face increased barriers in transitioning to more appropriate housing solutions. So whether this involves downsizing or coping with disability and frailty or other age-related drivers. To address this, we're calling on the Victorian Government to expand affordable housing options to better respond to the needs of older people. So this should include targeted places and new social housing developments with capacity for in-home care, medium density alternatives for older people falling through gaps in the market, and financial incentives for those who wish to downsize. We're also calling for greater investment in proactive housing support, community education, and individual advocacy. So this includes expanding the Home at Last service, increasing outreach for trusted community agencies, and growing the Retirement Housing Assistance and Advocacy Program. While we welcome the Victorian Government's housing statement and its rental stress support package, these efforts do need to be sustained and expanded. So we're recommending the extension of the package with an older person support stream to address the specific needs of older people in the private rental market. So we've covered the 5 key priority areas. I'll hand over to Ben now. He'll talk through the next steps.
Thanks, Margarita. So, within the next hour, our full submission will be made available on the COTA Victoria website. We welcome any questions, suggestions, or further discussions, either at the end of this presentation or via a separate meeting. We are definitely open to continuing this conversation. Furthermore, we will soon be sending our submission to Victorian Government ministers via personalised correspondence and to relevant stakeholders and like-minded NGOs. We will also be engaging with key government stakeholders from now until the budget. And this is the key thing. We are currently just over 6 months until the next budget. And while we understand we are operating in a constrained funding environment, it is incumbent on us to make sure that we are driving the key message and advocacy around the need to support older Victorians. And we think the 2025-26 budget is the right opportunity to do so. And we really think that we've put together a package here that really captures a lot of the key holistic elements around ageing in this state, which we're really keen to continue and take forward. So, this brings us quite quickly onto our questions and comment sections. I appreciate we did put in an hour for this session, but we're always of the belief that if we can give you time, that's better. And we'd rather say it succinctly than waffle on. So our contact details are on the screen. And we, as I just said, we welcome follow-up conversations, feedback, and opportunities to collaborate moving forward. And so with that in mind, we now have time for any questions. I will just note that we have had a question in the chat from Silvana. Lovely to have you here, Silvana, around the number of respondents to our survey. So that was 64. And thank you, Fiona York from Haag. We definitely do support the Home at Last and the work that Haag in particular do in driving this conversation and supporting older Victorians who are increasingly facing the stress of housing insecurity. And that is absolutely something that we need to address. But if there are any further conversations or comments that you'd like to make to us about this or any related issues, we are all ears. It could be on anything. We are more than happy to answer any questions. But I also appreciate that it can be necessarily hard to come up with questions at the moment. So let's maybe focus on that. Let's maybe say that we are open to continuing this conversation. And again, you should have all our contact details are available on the screen, and you should hopefully have our contact details through the invite and through seeing the event. So please do come and speak to us. But in that case, we will wrap things up. So I will just flag that we are a membership organisation with free individual membership, and it's through our engagement with members that we get to come up with these asks and develop our asks and advocacy to the Victorian government in particular. You can see that through the survey that directly informed our work here today, and through the engagement with members that has informed all our other work, which is available on our website, including in particular a number of member briefings, which capture that. And this is something that is only going to continue and grow. So please do engage if you would like to become an individual member. And this is absolutely something that we will be extending. And we do invite you. We think we have a good membership ask. And all that remains to be said is to say thank you all so much for attending. We deeply, deeply appreciate it. And we look forward to continuing this conversation with you if you're a member. And we look forward to continuing this advocacy with you if you're from the Victorian government. And we're looking forward to advocating alongside you if you're from the sector. Thank you all.